Hey everyone, welcome back to Injecting Knowledge. I'm Nurse Kaylee, and today we're going to discuss invasive hemodynamic monitoring. This is crucial for taking care of critically ill patients. This is crucial for healthcare professionals and nursing students to understand. We'll cover what it is, the different types, when it's used, and the importance of performing an Allen's test before placing an arterial line. Now, let's get into it. Invasive hemodynamic monitoring allows us to closely measure a patient's blood pressure, fluid volume, and heart function using specialized catheters placed in arteries or veins. It's commonly used for critically ill patients who need precise cardiovascular assessment to guide treatment. So why do we need invasive hemodynamic monitoring? Well, it helps manage patients with conditions like shock, septic, cardiogenic, or hypovolemic, heart failure, severe burns or trauma, major surgeries, especially cardiac or vascular surgeries, acute respiratory distress syndrome, kidney failure requiring fluid resuscitation, and unstable blood pressure or perfusion issues. Basically, if a patient is hemodynamically unstable, this monitoring helps us make critical decisions in real time. Now, let's talk about the three main types of invasive hemodynamic monitoring you need to know. Central Venous Pressure, or CVP, mean arterial pressure, or MAP, and Pulmonary Artery Wedge Pressure, or PAWP. Central venous pressure, or CVP, is measured via central venous catheter, usually placed in the subclavian or jugular vein. The normal range is 2 to 8, and this gives us insight to right atrial pressure and fluid volume status. A high CVP is interpreted as fluid overload, heart failure, and pulmonary hypertension, and a low CVP is interpreted as hypovolemia, dehydration, and blood loss. Next is mean arterial pressure, or MAP. MAP is calculated by multiplying the diastolic number times 2 and then adding it to the systolic number and dividing it by 3. The normal range is 70 to 100, and a minimum of 60 is needed to perfuse the organs. MAP is measured through an arterial line, or an ART line. This helps assess perfusion to vital organs. A low MAP indicates shock, sepsis, or heart failure, and a high MAP indicates hypertension and vasoconstriction. Before inserting an ART line in the radial artery, we always perform an Allen's test to check collateral circulation from the ulnar artery. Here's how it's done. Ask the patient to make a fist, compress both the radial and ulnar arteries. Have the patient open their hand, the palm should be pale, and release only the ulnar artery. If the hand pinks up within 5 to 10 seconds, circulation is good. If not, we avoid using the radial artery and choose a different site. Lastly, we're going to be discussing pulmonary artery wedge pressure, or a PAWP. This is measured via pulmonary artery catheter, or a Swan-Ganz catheter. The normal range is 6 to 12, and it reflects left atrial pressure and left ventricular function. A high PAWP means left-sided heart failure and fluid overload, while a low PAWP means hypovolemia and dehydration. And that wraps up our breakdown of invasive hemodynamic monitoring. Remember, this is crucial for taking care of critically ill patients and guiding treatment decisions. Now, if you found this video helpful, don't forget to like, subscribe, and hit that notification bell so you don't miss any future content. And drop a comment below if you have any ideas for a future topic that we can discuss. Thank you. I'll see you on the next video, and happy studying.